In early February 2018, a small delegation from Alfred Health in Melbourne, Australia went across to Tanzania to visit Muhimbili National Hospital in the city's capital, Dar es Salaam. The purpose of the visit was fourfold. One was to visit Alfred staff member Libby White, who had been on secondment for 18 months up until that point in time, to provide some executive leadership advice and strategies, delivering a leadership development program, and then strengthening global partnerships, both with the local hospital, but other partners that they engage with as well.
I think the big picture needs to be continuity, to develop a relationship between hospitals and to keep that relationship going so that you understand the challenges that each other are facing and support each other through those times.
We were greeted by Libby White, who introduced us to the head of emergency medicine, Dr. Juma Mafinanga. Juma took us on a tour of the hospital, first of all to meet all of the senior leadership team, to not only introduce us and almost to kind of give us this unspoken blessing to proceed with our work and interactions with the rest of the teams. Dr. Faraja was proud to share the recently developed strategic plan for the hospital, and this would become a targeted conversation that the team would have over the coming week, providing some advice and some feedback and some lessons learned from Alfred Health's perspective in terms of bringing a strategic plan to life. Sister Agnes talked to us about some of the challenges they're facing from a resourcing point of view. They have a critical shortage of nurses, and interestingly, it's the government that does the recruiting. The emergency medical department in Muhimbili was launched in 2010. They see around 200 patients a day. 40% of them are covered by national insurance. Computers and the software that go with ED was only introduced in 2015. Paediatrics make up about 20% of the patient population at Muhimbili, and here they're knocking out some walls to create greater capacity to treat them. Recent good news for the hospital was the ability to build a new extension, 70% of which was funded by Muhimbili National Hospital and 30% by the Abbott Fund. The team do have a real commitment to quality improvement, and it's just a matter of trying to get some consistency throughout the hospital.
For me, the most outstanding feature of today was how proud these people are of what they've achieved.
This is a very impressive place. They've got their own initiative, they're highly motivated, they're very enthusiastic.
They didn't really talk about themselves, they talked about their team and how proud they were of their team.
Especially the level of patient care they provide with very limited resources, which I think is absolutely phenomenal.
So our challenge is to provide them something to augment that somehow and to support them in that.
I can see that there's the real foundations of what could be a really strong leadership team.
The leaders are in their early 30s and they are running emergency care for the country.
An exemplary version of how our senior leadership need to conduct themselves in the international arena. It was a privilege to be able to deliver a leadership development program for the ED staff of Muhimbili National Hospital. The team really loved the aspects of leadership that we were covering. They really just came alive to focus on leadership styles and the best attributes of leadership.
The feedback's really positive and they are relating what they're learning to the clinical situation or to the situation that they're in as young leaders. That can provide a level of care that you could take them out of this environment and put them in at the Alfred and they would fly.